Hello, I'm Deborah Garlick from Henpicked, and thank you for joining us today. Now, the topic of today's conversation is bone health. It's Menopause Awareness Month, and 18th of October is Menopause Awareness Day. And the theme for this year is bone health. So I'm absolutely delighted to welcome Dr. Marilyn Glenville with us today. Now, Dr. Glenville is the UK's leading nutritionalist specialising in women's health, and she's the former president of the Food and Health Forum and an all-round fantastic expert. So it's a pleasure to have her here today, and we're going to be focusing on the natural approach to us managing our bone health. So welcome, Dr. Glenville.
Hello, Deborah. Lovely to be with you today. So thank you very much for the invitation. And like you said, it's such an important topic, and I'm not sure we're talking about it enough. So really pleased that you've brought this up and that we can share some information today.
Absolutely. Now, I know we've talked about bone health a lot before, and it is such an important subject. So can you tell us why it's so important to look after our bone health?
Well, as women, we reach our peak bone mass around the age of 25, 30, and it pretty much stays stable until we get to the menopause. And then, because of estrogen declining, there can be a decline in bone density. And it's one of those where it can affect 1 in 2 women over the age of 50 compared to 1 in 8 for breast cancer. And yet we have this national screening program for breast cancer, and we don't have anything in terms of osteoporosis. So it's something for me that's really important to think about for women, and maybe even think about it earlier than we are sort of thinking about it at the moment.
Now, there's 2 interesting facts there. 1 in 2 of us may experience it, and also over 50. So that's significantly more than many of us realise, and significantly younger too.
Yes, and absolutely. And that's what we need to be thinking about. I know we think of it as an old person's disease, this sort of dowager's hump, you know, where they've got that kyphosis and people breaking their hip around the 75, 80-year-olds. But it's actually thinking about it much earlier. And we can talk about how people can test for that, is to think about, you know, is it important to know what the state of your bones are much earlier, so that if there are risk factors there, or the bones aren't as good as they can be, you could actually take action earlier. And really with osteoporosis, what we're aiming for is prevention rather than waiting until something's happened that makes it more difficult to treat.
So what are the risk factors then? How might I know if I'm going to be the 1 in 2 that struggles with my bone health?
Well, it's interesting because we're thinking of things that maybe happened earlier in life. So there will be some women who maybe earlier on in their 30s lost their periods for up to 6 months or so. And that can be a risk factor because they were without those hormones much earlier. Something like a premature menopause can do it. Being on steroids, and that can affect men as well as women. So that's sort of a side effect from medication that could increase the risk of osteoporosis. And any kind of digestive issue. So women who have got Crohn's or something like celiac, anything where the absorption of nutrients may be compromised could be a risk factor. Not enough exercise. So it's one of those where we need that activity. And it's just thinking of those issues that might increase the risk, and also thinking of a family history. So a mother or a grandmother might not have had a definite diagnosis, but you notice that they were shrinking, maybe they had that dowager's hump. So there can be a really strong family history risk. And then it's thinking, you know, should I do something about this now? Should I find out what the state of my bones are earlier? And then if they're not so good, take action much earlier rather than waiting until the fracture happens.
When you say osteoporosis and the state of our bones, what does that actually look like? What does that, how might you know if your bones are not healthy?
Well, literally, it means porous bones. So the bones have become more porous. It's almost looking like, if you think of a Malteser cut in half, and yet there's much more there's more porosity there, and there may not be any change in shape. There may be no symptoms at all, no pain at all. And what I see in the clinic is that actually the first sign of this is actually a fracture, because this is going on very silently. The bones are becoming less dense, more fragile, and then just a simple knock, say against the side of a desk. Or I've seen women walking along, they've explained, that they've rolled over on their ankle and they've got a fracture. Or one lady was talking about just sitting in front of the television and she sneezed and fractured her rib. And that's when that's gone on very silently, because there aren't definite symptoms. So it's thinking about risk factors, maybe medication that you had to take in the past, family history risk. And almost, I think that it would be better for all of us women to have what we call a DEXA scan, which is the scan that's looking at this mild X-ray that's looking at the bone density in the hip and the spine, and have it as a screening tool and find out where we stand, what's our baseline. Are we starting to show problems with lower bone density, which is osteopenia, and then being able to do something before it goes into osteoporosis. So for me, prevention is always really the key, if we can work on that sooner rather than later.
That's really interesting, isn't it? Because we often say that menopause is a time to think about your long-term health, etc. But actually what you're saying is we need to be thinking about it well before then.
Yes, and I think in terms of our exercise, this use it or lose it with our bone density, but usually they will do the scan if you've got family history risks or been on a medication that could increase your risk. You might be able to get a DEXA scan. It's DEXA, dual energy X-ray absorptiometry, on the NHS. An ordinary X-ray won't do it for bone density. You need a proper DEXA scan, and you might get it on the NHS, and lots of places in the country will do it. Some won't. It just depends on where you live. Obviously we can organise it privately for you, but it's one of those where I think if you can get it done, at least you know where you stand at the moment, and then think about if it's good, then you know what you're doing is working. If it isn't and you're starting to get lower bone density, this osteopenia, then it's sort of a bit of a wake-up call to think, what do I need to change, either with diet or certain nutrients or exercise, to actually stop this getting worse? So I think screening would be really useful, just as we have, the breast cancer screening as well.
That's really great advice. But if I know I'm at risk of osteoporosis or poor bone health, I know my grandma had very poor bone health. I can remember her having her arm in plaster when we started to know that that was what was going on. But what can we do about it? What is the best advice for all of us to look after our bone health?
Well, there's a number of things. If we think of the food side, first of all, it's really interesting to follow something like the Mediterranean diet, and to put more emphasis on our diet being more alkaline. So calcium is stored in our bones and our teeth, and it's a neutralizer. It neutralizes acid. So when women start to follow a very acidic diet, and that's when it goes up into the high protein. So things like the Dukan, the Atkins diet, which has been, some of these have been very popular for a number of years, but they're not good for us around the menopause, because the more acidic the diet becomes, the more calcium actually gets leached from the skeleton in order to neutralize that acidity. So we need our fruit and veg. We need a good balance, but not going too mad. It's the animal protein that's the issue, not so much vegetable protein. We all need a balance, but it's actually creating more of the fruit and veg, the more alkaline effect you want for your bones. And if somebody already knows they're at risk, then it's doing this a bit more than somebody else. And it may be thinking also about things like caffeine, which can be very acidic. So it doesn't always seem fair that somebody can get away with, certain things in their diet and others can't. We always have to look at our family history, our risk factors, and think, what do I need to do to work on my bone health, which may be a bit more than somebody else has to do, because they don't have that family history, they don't have those risk factors.
And that was really fascinating, because many people do follow the keto diet and we're encouraged to eat plenty of protein.
I know. I know, but it's not good for us around the menopause. The other concern is it's not good for the kidneys either, because we've got to process that amount of protein. But the research shows that the vegetable protein is fine. So the quinoa, the nuts and seeds, we do need some protein there, we do. So that could be animal protein going in, like fish and eggs, but it's making sure you've got enough alkaline to weigh that up. And that's very different for us at the menopause in terms of our bone health than a different stage in our life. So it's not a good route to go down when we're trying to protect our bones for the next actually 30 odd years. So we've got a long term in terms of how we want to keep our bones healthy.
And you're right, actually. You say 30 years, could be 40 years, could be 50 years, could be half a century.
It could be, you're right. Yes, it could be. They think now we've got 30 to 50 years past the menopause. So it's how do we have that extra third of our life with this wonderful quality, both physically and mentally, and protecting our bone health.
And it's absolutely makes bone health even more crucial, doesn't it? So we've covered off a little bit about diet, exercise. That's important too, isn't it?
It is, and it's one of those use it or lose it ones around the menopause, and we have to make the demand on the skeleton. And when I give talks on this subject, I talk about the Russian astronauts that went into space many years ago, really fit men. And when they came back, they'd lost a huge percentage of bone density. So your body doesn't produce something it doesn't need, and in that gravity-free environment, it didn't produce that bone density. So we have to make the demand on our skeleton, and it is important to do things that create the demand. So things like walking, it may be dancing, things like that. And interesting, they've also looked at other exercises like yoga, which are not the same sort of impact, but they've realized that if we can learn to balance and our coordination is good, and we're not then have the risk of falling over, we're not likely then to fracture our wrist when we put it down. We're not likely to have a hip fracture. So with the exercise, we want the demand on the skeleton, and we also want to think about our balance and coordination so we don't end up tripping over and then putting down an arm or whatever to protect us and then ending up with a fracture.
Right, so great advice there. And what about supplements? Because I know I've got your vitamin D, by the way, thank you very much. And so I know vitamin D is important, but anything else that I need to perhaps think about making sure I've got enough in my diet or supplementing?
Yes, and you're right. And vitamin D is crucial. And I've seen some women in the clinic who've actually developed osteoporosis because of a vitamin D deficiency. And again, it's silent. You wouldn't know that you're lacking in vitamin D. And the issue is it's not like somebody who's tired, who's anemic, and then thinks, yes, I need to see my GP. I am tired. I could be anemic. There's no symptoms. And you actually need vitamin D to absorb calcium. And it doesn't matter how much calcium you could be putting in there. If you haven't got the vitamin D, you won't absorb it. Calcium is still important. Magnesium is also, and that helps convert vitamin D to its active form. So I've always found that combinations of nutrients are much better than single ones. We also know vitamin K2 is important now as well. So we have some really good combinations that we use in the clinic, and also the ones I use have got digestive enzymes in there. They're by a company called Natural Health Practice, and all the time with your bone health, it's not just a question of making sure we get the nutrients in, it's also making sure that we digest and absorb them. So digestive enzymes are really important, especially if somebody's got a digestive issue, because that is one of the risk factors for osteoporosis. So it's thinking about a good diet, but we've got to digest and absorb those nutrients, whether they come in supplement form or in food itself, in order to be able to absorb them. And an interesting one that many people might not think of, and I know we've, over the last 18 months, people would have talked about vitamin C for immune function, and it is very good, but it also manufactures collagen, which makes up about 90% of our bone matrix. So it's really important for our bone health, and also important for our skin and that elasticity, because it's aiming to stop wrinkles. So we want that elasticity in that connective tissue. So vitamin C is important. Yes, it's important for your bone health, your immune health working to the winter, but it's absolutely critical for your bone health as well because of that manufacture of collagen.
Mentally, I'm shopping in my head, so I hope you're going to give us all some links so that I can share those and get them, because often when I'm taking vitamin D, I worry, am I taking the right one? Because there's different types, and can I take too much?
And it should be D3, not D2. We know that D3 is 87% more effective in raising and maintaining vitamin D levels than D2. And your question, Deborah, is really good, because when I do webinars, people always ask me, how much vitamin D should you take? And I would say, on a daily basis, you could take 2000 IUs. But I would suggest what would be even better is to test vitamin D. And we do it in the clinic with a simple finger prick test, because actually some people have needed much more just for 3 months to correct a deficiency, because it was actually rock bottom. And just for 3 months, and then afterwards you just maintain it. And we're going to go in from October to March, this time of year, where it's actually going to be very difficult in maintaining our vitamin D levels, because our body does not expect us to get much from food. We'll get a bit from oily fish, egg yolks, but the main manufacture is through our skin in the exposure to sunlight, which we won't get. So it becomes even more important for this period of time, right until March, when we're going to have, the clocks will change, we're going to have a lot of darkness going on. So we really need to keep it over the winter, and we need to keep it in there for our immune function. It's an immune modulator. It brings up our immune system if it's too low, and it brings it down if it's too high, which is really relevant for people with an autoimmune condition. So it's got so many benefits. And I would suggest test. If you haven't been able to go out in the sun, maybe you've got a history of skin cancer or something like that, you really want to know how much should you take, and then maintain it over the time. So that's really important.
Thank you. But can you take it even if you don't need it? So if somebody doesn't test, is there health risks in taking it?
Particularly not at this time of the year. And that's why I would go for the 2000 IUs, because that's the level that would be good. We do store vitamin D, and it does become toxic at high levels if somebody does mega doses, but you'd only, you wouldn't do that unless you absolutely need it. But 2000 IUs a day for us as women, 400 IUs for our children would be really good. And that would be absolutely fine, and a brilliant amount to take to get us through the winter, not only for our bone health, but for our immune health as well. So that would be a really good amount.
Thank you very much, Marilyn. I feel like I'm having a personal consultation here.
But it must be D3, and you need to read the label and not D2, because you're almost wasting your time and money.
Absolutely. And can vegans get D3?
Yes, they can. And the one we use in the clinic is actually from lichen. So we don't use any now from lanolin. So again, it would be clear on the bottle. It doesn't have to come from that, the sheep side of it. It can actually come from lichen. So yes, absolutely fine, and really need it just the same as we do. So whatever diet we're on, we need it, because we're not going to get it from the food. We have to usually manufacture it, but we won't from October to March, unless we were going to Florida at Christmas. But I think travel might be out at the moment, Deborah. So I don't think we're going there.
So that's fabulous. It's great to hear all of the things that we can do to prevent. A little bit of a question from me. If you're diagnosed with poor bone health, can you reverse it?
It depends on what stage you're at, whether it's in the osteopenia or the osteoporosis range, and your age as well. So there's different factors going on, and whether there's something, whether it's a medication changing it, and that could be altered because they could go on a different medication, where there's something so striking like the vitamin D deficiency and somebody's physical activity. And we talked about the DEXA scan, which is brilliant, because that's looking at the bone density in the hip and the spine, and gives 3 readings, either normal, osteopenic, which is low bone density, or osteoporosis. But you can't really retest it for at least 2 years because the machines aren't sensitive enough to pick up the changes. So somebody may say, well, I'm going to take some vitamin D, maybe calcium, magnesium, start exercising. They're not going to know for at least 2 years whether it's actually made a difference. So in the clinic, we also use something called a bone turnover test. It's written about in all the medical literature. It's just not available on the NHS, and it's done with a urine sample. And it measures those collagen markers that are excreted as the bone breaks down. So all the time, our bone is building up and breaking down, except as we go through the menopause, there can be more breakdown than build up, so the bone becomes less dense. And we can measure it in a urine sample. And if the bone turnover is too high, it means you're losing bone actively on a daily basis. But it means then if somebody says, okay, I'm going to start walking, I'm going to put in my vitamin D, I'm going to make sure I'm eating really well, 3 months' time, we can measure that bone turnover and see that what they're doing is working. And it gives people real confidence to know, well, actually, this is making a real difference, and without waiting 2 years for the next DEXA scan. So it's monitoring the effectiveness of treatment. Sometimes it's used for osteoporosis medication. We use it in the clinic to monitor the effectiveness of dietary changes, supplements, exercise. But it's absolutely brilliant because you can do it, samples collected at home, and it's measuring how fast you're losing bone on a daily basis.
That's absolutely fascinating. You can tell I'm so interested in all of this because it can happen at any time. And if you've ever seen anybody struggling with it, you really appreciate how fundamental this is to our general health. You know, that skeleton, as you say, it just affects so much. Yeah. And I'm going to ask my colleague, Sally, because I can see there are so many questions coming up. Sally, what were the key themes from the questions?
Absolutely. I mean, you've answered a huge amount, and I think people are really appreciating this. One of the big things people were asking around access to getting things like a DEXA scan, and really that how do you tell whether you're at risk? And it's what we were talking about earlier, that it's actually quite difficult to know you're at risk unless you have that family history. Is there anything else people should be looking out for?
Yeah, so family history and also steroids. So maybe somebody's had something like rheumatoid arthritis and they've had to be on steroids for a number of years, or a medication like heparin. And in that situation, they could more likely get it on the NHS. Any kind of digestive issues, so celiac, Crohn's, anything where it may be affecting absorption of those nutrients, then that's a possibility as well. So, and other women who've been on things like laxatives over the long term, it's always thinking about, are we actually digesting and absorbing the nutrients that are going in? Otherwise, that can be a risk factor. But I try it first with the GP, because if you get into the system, and it means then you will be monitored in a couple of years' time. So it means you've got that track record. Yes, we can organise it privately. If you hit a brick wall, and depending on the area you live, they may not have a DEXA machine. That's the crisis, really. Not every place will have a DEXA machine, and it needs to be, and I know the National Osteoporosis Society would love this, to have a national screening programme. Because if we got this much earlier, people could think about, oh, well, I'm not doing enough exercise, I need to do something else, rather than actually waiting the fracture. Once you've got to the point of the fracture and that's the diagnosis, you've got osteoporosis. That's quite a way down the line. So us having a screening like we do the breast screening would be wonderful. And I would say to women, if you can't get it because you don't have enough risk factors or medication that would put you at risk, then do it privately, and it would be worth it, even just for a one-off, to see what your level is. And then if it's not good, whether you've done it on the NHS or privately, I would suggest doing the bone turnover test, because then that's a way of monitoring whether what you're doing is working. Otherwise, it's unknown for a couple of years.
Yeah. Fantastic, thank you. We had also questions around exercise, and obviously you've talked about how important this is and the impact it can make. People have asked about strength and weight training exercise and what that can have.
That's interesting, because actually when you think of the muscles are attached to the bone, and if you strengthen your muscles, you're strengthening your bone to match that muscle strength. So yes, the weight training could be really good. Where I think it's not as helpful is swimming, and that's almost like the gravity situation with the Russian astronaut. So it's wonderful for cardio side and the stamina and everything else, but it would need to be mixed and matched with something like impact, or the weight training, yes, is good, because that's actually strengthening the bones in a different way other than just the impact. And I think a mix of exercise, including the yoga or anything that gives us that extra balance and coordination, is really an all-round exercise program.
Yeah. We've had a few queries which are quite unusual around the impact of tomatoes
yes.
from a diet, from somebody's at joint pain with fibromyalgia, the physios talked about them, someone else is saying that it can have an impact on osteoarthritis and things like that. Just wondering whether that's something you've come across before.
Yes, obviously when we think of osteoarthritis, we're talking about something slightly different, and we're talking about inflammation, and that's when things like the omega-3 fish oils really come into their own, because they're anti-inflammatory. And there is a group of foods, if we think of a deadly nightshade family, and that would be tomatoes, aubergines, I've lost the other ones at the moment, courgette, potatoes would be in there as well. So a nice ratatouille would be not a good idea. But it has been linked to people who have an issue with their joints. I haven't seen it as much of a concern. I know it could suggest more acidity, but I haven't seen it as much of a concern in terms of osteoporosis as I have with joint pains. And osteoporosis doesn't necessarily give any pain, and that's what's so silent about it. People think they're going to feel it, but they're not going to feel it. It's just this change in density, this porosity within the bone, not necessarily pain, no change in shape, until they get a low trauma or a knock, and then they've got that fracture, and that's where the fracture can be the diagnosis. But there doesn't necessarily, and most often, no symptoms whatsoever, and that's very different from joint pains and things like osteoarthritis.
Yeah, and I think that's really helpful for people to see that difference. We've just got last couple of questions. So someone's asked, is there any age where it's too late to stop taking vitamins, to stop further deterioration?
No, obviously there comes a stage where we're basically trying to stop it getting worse.
Yeah.
That earlier on, we're always trying to improve it. So going from osteopenia back to a normal bone density, there will come a point when we're trying to stop it getting worse. And that is still really important. And the nutrients that are taken, whether it's calcium, magnesium, and particularly vitamin D, is now known to have so many benefits in terms of our general health. And the other crucial thing is actually Alzheimer's. And vitamin D and things like omega-3 have such an effect on our brain function. And for us now, Alzheimer's is our biggest killer as women. So what we're talking about in terms of our brain health, bone health, and looking after ourselves for the next 30 to 50 years, where the nutrients that we're taking can have that effect on our brain as well. So vitamin D really comes into its own into the long term.
Fantastic. That's great. Thank you very much. Really appreciate that. And I'll pass back to Deborah to finish.
Thank you very much, Sally. And thank you very much, Dr. Marilyn Glenville. Now, I've put this on the screen. I'm sure your team have talked to you about it. I think they might have sent this to me. And I did say, can we share it with everybody else that dials in today? Because I was keen to sort of understand what I can do about my bone health. Fascinating subject, and so much great advice there. Thank you very much, Marilyn. And this is an offer that's available to everybody on this call. That's correct?
Yes, it is. And until the 12th of October. And there's also a saving on a consultation. And we're also offering a 10-minute discovery call. So people who might be worried about their bones and not sure whether nutrition can help or what path they should be going down, then a 10-minute discovery call, happy to do that with my team of nutritionists, even before somebody's made a decision about a consultation. So Deborah, we're happy to do that, because obviously people are not sure what they should be doing or what tests might be available. So really happy to share that information with them.
Thank you very much. I will ask you for some information, because we'll send out some information after this session today with those links. I do want that one for the supplement that you were talking about, the dietary, because I think I'm taking a bit of everything, and I do always wonder if I'm actually taking the right thing. So I'll ask you for that for everybody on this call too. But thank you very much. As always, an absolute pleasure. So thank you for joining us today.
Deborah. Thank you for the information and picking this up as a topic, because it does, like you said, sometimes gets forgotten, and we think it's older ladies, 75 or 80. Yes, it does happen then, but what we're doing about it needs to be much earlier. And that supplement you mentioned, it's called Osteo Support, which has got all the nutrients in there and vitamin K2 as well. So that's a good all-round combination.
Wonderful. Thank you very much. And thank you for joining us today. Do let us know of any other subjects you'd like us to cover. And we look forward to seeing you in about 2 or 3 weeks' time. But in the meantime, we hope you have a happy World Menopause Day on the 18th of October. Thank you very much.